The US withdrawal from the World Health Organization (WHO) has caused serious concern in the international scientific community. Dr. Demetre Daskalakis, former head of the CDC's vaccination committee, in an interview with Euronews, mentions the risk that may arise from this decision.
What that means for people's health is that, we won't have flu vaccines that are as good because we won't be at the table to discuss the flu vaccines. We may not have the same visibility into emerging infections. And frankly, the US withdrawing from the WHO, given the fact that they were a pretty important contributor to the WHO, means that the WHO won't be as well prepared to be able to address emerging outbreaks and infections. So I think overall, the US pulling out of the WHO isn't just bad for American health. I think it's bad for global health.
According to Dr. Daskalakis, Robert Kennedy's health policies are causing confusion in Europe. This, he said, presents an opportunity for Europe.
I fear that the Secretary of Health in the United States, Robert F. Kennedy Jr., is going to destabilize the vaccine infrastructure in the United States. I am concerned that manufacturers in the US will feel that it will be no longer feasible to be able to manufacture vaccines. So I think it's a challenge to the European Union, but I think it's also a great opportunity because I think the US is going to unfortunately leave a very significant healthcare and public health vacuum globally.
The former White House official also referred to the issue of HIV treatment, the focus of his work for many years, which the Trump administration cut its funding in US aid.
Millions of people have been put on antiretroviral, anti-HIV medications, prolonging their lives and preventing progression to HIV or to AIDS and to death. And so I think anything that destabilizes that infrastructure may mean that we're going to lose ground. Also, I think some of the efforts of the current administration to erase some of the priority populations that are served by PEPFAR will also be problematic. So, drug users, LGBTQ people are all part of the story for HIV. And so any effort to create social stigma around those issues will end up driving people away from prevention and care. The HIV infrastructure that supports everyone's health is also critical for public health security. If that falters, then I think the entire world will be a less safe place, not only for HIV, but all other emerging infections as well.